definitely pleased to welcome to the podcast Dr. Akeem Marsh.
This person, has some things going on with them, and I'm here for support in whatever way I can. And it was like, actually, I think all these kids want to do therapy. They just don't know it, or just haven't found the right platform or opportunity.
Do physicians ever tend to overprescribe particular things? I often hear that sort of thing when it comes to like antidepressants. How do you kind of utilize maybe some of those holistic aspects so that it's not just aggressive sort of medication thing, but really looking at it in a way where kind of seeing like what's going to help the patient and doesn't end up overwhelming on that particular
That's
side?
That's a great question. I would say
Hey, my name is Charpentier, and welcome to Less Than 3%. We talk about healthcare, my journey to become a physician, and really anything from the perspective of a black male pursuing medicine. And in this episode, I have a really exciting conversation for you guys. I have a really well-renowned guest, and so I'm definitely excited to introduce the person for today's episode. And before I get into it, I just want to make sure you guys know, if you're watching on YouTube, make sure to subscribe, hit notifications, like it, send it to somebody you think would enjoy the episode. If you're listening on Spotify or any other platforms, be sure to give it a follow. Share that with anyone that you think will enjoy the episode. And with that being said, let's get into it. So the guest for today's episode, he received his Bachelor's of Science degree in 2007 from the Sophie Davis School of Biomedical Education. He received his medical doctorate from the SUNY Health Sciences Center at Brooklyn Downstate College of Medicine. He completed residency in general psychiatry in 2012 and his fellowship in child and adolescent psychiatry in 2014 at the Zucker School of Medicine at Hofstra Northwell. And to go even further, he is a nationally recognized expert on the link between trauma and disruptive behavior disorders. He serves as the medical director of the Home for Integrated Behavioral Health at the New York Foundling and a consultant member of the Very Well Mind Review Board. He's a clinical assistant professor of child and adolescent psychiatry at the NYU Grossman School of Medicine. He's a distinguished fellow of the American Academy of Child and Adolescent Psychiatry. In January 2022, he published his seminal work that he co-edited, Not Just Bad Kids, The Adversity and Disruptive Behavior Link. In August 2023, he was appointed by Mayor Eric Adams to serve on the city's first ever Juvenile Justice Advisory Board to advise and provide recommendations to the mayor, the city council, and ACS on issues related to juvenile justice. So with all that I just said, I am definitely pleased to welcome to the podcast Dr. Akeem Marsh.
Thank you so much for having me. It's a pleasure to be here with you, man.
Yeah, thank you for coming on the podcast. I'm definitely excited to have you as a guest. So I know I gave a bit of an introduction. Would you be able to give everyone listening an introduction into who you are?
Yes, sir. Well, first and foremost, I am originally from New York City. I'm originally from the Bronx, and I am a very proud graduate of the Sophie Davis School of Biomedical Education at the City College. And I would say that, that's basically my family. Ever since I was there, I really have stayed actively involved despite, all these other places I've been and things I've been doing. Like, that's really important to me, the success of the students and the school itself. So, there's so many things you could say, but I feel like that's most relevant for me right now. Yep.
Yeah, it definitely matters. That's a huge part.
Mm-hmm.
So I know I mentioned a bit about what you do, and you mentioned some of the things that you're also doing in terms of being involved, in different schools.
Mm-hmm.
So first and foremost, I definitely want to ask you, because at the core of even this interview, you've obviously gained a lot of experience over the past number of years as a physician and taking care of a lot of patients.
Mm-hmm.
What first got you interested in medicine to even begin with? Like, what got you going towards becoming a doctor?
I appreciate that. That's a great question. So I think it stemmed back from high school when we had to decide next steps, what we're going to do with our lives. And historically, I'd always been really interested in science, like biology, chemistry. Like, I really thrived in those courses. And it was like, I understood them and was also like very curious. And then the other component of it was like, what do you do with science? You know, you can go computer science, you can go engineering, you can go pre-med, healthcare. And I ended up choosing that track because I looked at it as a way of one, challenging myself, and two, I wanted to work with people, and specifically kids. Actually, like I had grown up around kids my whole life, like lots of nieces, nephews, cousins, like always around. And, you know, as a result of those experiences, developed an interest in working with kids as well. So I would say those really planted the seeds. And then when I discovered the Sophie Davis program, it was like, oh, this looks like something that could be a good fit. Ended up applying and getting in. And I would say it definitely turned out to be a good fit. So, you know.
I think you said a lot of pretty interesting things there. I think one thing I noticed from what you mentioned was kind of that background of always being around kids, you know, because I definitely, like when I talk to, you know, like classmates and stuff like that who I know are like interested in pediatrics and things like that, a lot of times I do notice a bit like a common pattern of like there's some level of like a personal connection to that. And I'm sure with a lot of other specialties as well.
Of course. Yep.
Yeah. How would you say maybe, or what are some of the ways maybe you've noticed your background with kids earlier on sort of connected or helped you out when it came to eventually having a career around that?
I feel like it, after planting the seeds like during childhood and then like during the time when I was in Sophie, a lot of it I was fortunate to be able to kind of build on that and have strength. So one of the things that I did early on was spend some time at the daycare center on campus, and it was actually part of like a fellowship program that they had available for students where, you know, you put in some hours for service and you got paid, and like I really enjoyed that like thoroughly. And so when that ended, I kind of tried to take advantage of other opportunities like that when possible, or other opportunities to work with kids. And so what I'm thinking of right now is like after doing like the core rotations that were required in medical school, the electives that I took were like in pediatrics and in child psychiatry. And let's see what else was there. There were like I know what, there were like other opportunities where we would sort of go to high schools, go to like recruitment events, and you know there were kids there, so it was always like a pleasure kind of talking to them, trying to get them to sort of expand their minds and see and think about different possibilities of what they could be. And so yeah, I always found like inspiration in working with kids, even now too. Like some people like, so in child psych, it's like, you know, you'll see a lot of kids who have been through struggles, right? Because that's what sort of leads them into seeking those kind of services. But even with that, it's like I still find like a lot of inspiration, because it's like, you know, it's like they're doing like really brave things by coming to treatment, by, you know, presenting themselves, opening up, and kind of, you know, doing what they can to sort of navigate through life. And I would say those things are really inspirational to me. So, you know, it's like we kind of vibe off each other, and I keep it going.
Yeah, that I think right there is something that's really interesting to me, because what you just mentioned there, if I'm getting this right, it's almost like I find it interesting how you're able to really draw inspiration from the patients that you're helping, because I guess from one perspective, of course, as a physician, you're looking to serve and deal with, you know, whatever problems are like right there for the patient. And you know, I would imagine it's probably easy to come in with a mindset of this patient is XYZ, you know, that's going wrong, and I'm trying to fix this and get from point A to point B. But I think the fact that you're really drawing lessons from the people that you're helping, I think is kind of like another aspect of it that I probably haven't really thought of that much.
Yeah, a lot of people, and honestly, that's kind of how it should be, because it's like every basically every person you interact with is like an opportunity for learning and an opportunity for, you know, maybe thinking about things a little differently, expanding your mind and horizons. And and it's like, you come in, and I also have the perspective where it's like there's nothing necessarily to fix because this person isn't broken. It's more like this person, has some things going on with them, and I'm here for support in whatever way I can, and then just try to do that. And then the other ways that I would say it is like an inspiration too is like incorporating different elements that helps you to relate to your population. So like depending on the age group, you bring in things like board games, Connect Four, Trouble. You bring in like music, like the teenagers, they put me on to some music, helping to keep me relevant. And the younger kids, it's like, I'm back in playing Connect Four, Trouble. Like, that's fun. Like, and then while this is happening, we're also talking about like some deep and sensitive topics. And it's like they're actually being able to express themselves in a way that doesn't feel like shameful, and it doesn't really feel burdensome, because we either listen, like sometimes listening to music or playing a game. And then next thing you know, it's like you got something out of it because you feel better from getting this thing that was weighing on your chest off. And then I feel better because I'm like, first of all, that game was fun. The music, I don't know if I really like it, depending on what it is, and I'll be honest about it. But hey, sometimes I do. I'm jamming with it regardless. And but yeah, it's fun. Like you can make it fun, even though it's like some of the things shared can be like really like, damn, you had to go through that. You went through that. Like what? But at least we're starting the healing process, or we're moving along that way. So that also helps to keep the motivation up, keep going forward.
I think that even kind of shows, I think, the aspect of medicine that I would say is pretty important, of kind of allowing, I guess, really having like that actual connection with someone, like as a person that you can relate to and you can connect with and get to know.
That what you just said is literally like the most important thing, like above and beyond like everything else. Like, there's certain, like obviously you gotta have your knowledge base, but you don't have to know like 100% of every detail of every little thing. There's like, we still have reference materials, we still have things that we can look up. But if you're not like interested and like able to really make that connection, we call it, it could be rapport or therapeutic alliance, along those lines, then it's like we're really kind of missing the mark. And it's really hard for any kind of improvement, any kind of progress without that. I would say it's probably like almost impossible. That's how a lot of times problems end up arising due to the lack of focus on that. I mean, it's not the only thing, but I would say it's like the most important.
Yeah, no, I think that's huge. And I think one thing I'm glad that I was able to learn, even earlier on in training and in school, was really the importance of that. And how I think a lot of times there are a lot of physicians, unfortunately, that I think can forget the aspect of medicine and kind of just think, okay, it's just a problem that I just got to fix and treat and move to the next thing, and forget like that there's like a real important patient connection that's being, made there, and that there's actual rapport that's needed, and having that really be sort of that driving force, or like a huge aspect of what you're doing as a physician.
That's right. School where I went to school, that was definitely like really, really up there as far as like what's important, what should be emphasized. And it was like literally classes, didactics, instruction on like how to talk to somebody, and making sure we were mindful of the different perspectives. And we actually, because of the type of setting that we were in on the City College campus, we were actually able to really get a feel for that in real time, in real life, because the campus itself is like super diverse, and our program was diverse too. So it was like, it was regular for us to interact with other people from different backgrounds, different cultures, and it was like that's normal for us. And it was so normal, like even when we got on each other's nerves, it wasn't something that could really stick around because it's like, yo, we're all at the end of the day, like we're all in this together, and we all have like the similar goal of trying to make it out. So, we gotta at some point, if there was ever any conflict, make some kind of peace, make some kind of agreements, and then let's move it forward. And then on top of that, the other thing that happened outside of the classroom, which I felt like was super important and enriching, was the fact that I felt like every week, every other week, there was like some type of big cultural celebration of different cultures, like from all over the world. And we're like listening to the music, eating the food, and just kind of vibing. And that was normal. And then so after having all of that, it's like we're ready to deal with almost anybody, not like experts, but it's like we're kind of like we have a certain type of familiarity that other places don't really have.
Yeah, I think that definitely shows something interesting as well, because I think one of the things I would probably say is, even like the example you just gave, I think for sure points out to, I think, the benefit that you can see from, number one, I think or at least medical trainees and people in positions like mine in medical school and even further on in training, that I think when you have a lot of different people from a lot of different backgrounds, they're able to get together, work together, train together, learn from each other, connect with each other. I'm sure I would imagine that definitely helps drive forward patient care in the long run, and being able, a lot of physicians from, regardless of whatever background they're from, being able to see patients from other backgrounds and be able to have maybe a little bit more of an understanding towards them, whether that's maybe even helping in terms of bias or any of those different things. Exactly. And so I think one of the points I always think about is like, I think when you have a diverse cohort and you have people that are ultimately getting together and committing to working together, I would imagine that definitely also helps bleed out into how they're able to take care of their patients.
Yeah, honestly, I think there's many ways in which the program is unique, and then at the end of it, like you made it out, like it's safe to say you're built different. You end up being built different. Like you start off different anyway, because most of the people come from like different high schools around the city and around this is the New York City area, but it's like we get together and it's like some kind of magic happens where it's like we're really getting to know one another and going through this really challenging ordeal together. And it's like a little bit of a different experience than what the people who go through the traditional way end up having. And so there's like pros and cons, strengths and weaknesses, but I feel like overall, in many ways, like we stood to benefit that.
How do you feel like, from the experiences that you remember from your time in medical school and training and all of that, how do you feel like maybe the experiences or some of the things you picked up from those times helped you ultimately in the career that you have even up to now?
Well, I feel like besides the core training, the core education, and everything like that, I really felt like when I was in Sophie, I had the opportunity for developing in leadership, and that's really when I was thriving as far as like being involved in organizations and things like that. And I think seeing other people involved, like doing things, that also was really helpful to me. And I felt like that kind of like allowed me to see my potential more and push me to want to sort of pursue different interests, go down different rabbit holes. And then in many ways, like out of that foundation, like I ended up taking a unique path, because like psychiatry and child psych, those were not common specialties, like especially for the black men. Like most of the black folks ended up doing like emergency medicine or anesthesia, although of course many also did like primary care, internal medicine and stuff like that. psychiatry wasn't up there like that, but I was like, you know what? I'm going to do psych. And then after going into psych and child psych, even at the time, like when I was pursuing it, it's so interesting at the time when I would tell people that this is what I was going to do, they would like look at me weird. Like, what? You want to do that? That's not real medicine. They would say like, wow. If you do that, something must be wrong with you. And I'm like, okay, whatever. And it's funny, like that was like the mindset and attitude of a lot of people. And then that was like over like between like say 10 and 15 years ago, right? But then now in 2024, it's like people are realizing that mental health, that's actually important. You know, that's actually like something we should be thinking about, something we should be, you know, concerned about and addressing. And it's like, wow, like see what's happening now. Like I would have never seen that coming. But then at the same time, knowing what I know, it's like, you know, I'm not surprised because, you know, all this stuff happens in the world and it's like, you know, it's going to have an impact on us. I mean, I know that now. It's going to have an impact. So, like, we have major events and catastrophes. So, that's going to have an impact.
Yeah. So, I think that probably segues perfectly into the next question I wanted to ask you. If you feel like you didn't already answer this, what actually, I feel like you answered as well. So, let me ask a little bit differently. So, if I were to ask you to give like a salesman pitch for the field of psychiatry, you know, if you were to talk to some of the people that didn't like it as much.
Let me tell you, I've been doing that. I don't know if it's really a salesman's pitch, but I've been like, listen, guys, low key, psychiatry is the best specialty. Low key. It's like people aren't looking at it like that, but let me tell you, it's like one, like the criticisms that, you know, people gave, like, oh, either it's not real medicine, quote unquote, so-called, or like all you do is like throw medication at people. And I gotta laugh because I'm like, well, what happens when you go to a doctor? They prescribe you medication. Like the only doctors who don't do that are the surgeons. They cut you up. Everyone else is giving medication. And then like, but you know, I think psych would be like, I'm saying like low key the best or like underrated because it's like, you know, you have the opportunity to like really, I would say really build like meaningful relationships working with your clients. And, you know, it's like there's more of, but not totally consistent in every work setting, but there's more of like an inclination or expectation of actually like getting to know folks, spending some more time with them. And when you're able to have like a meaningful impact on somebody like over time, like I feel like that feeling is like, you know, it's like yo, that's the best feeling. It just feels good, like to help somebody to feel better, especially, you know, thinking about how this person came to you and they were in a little bit of a crisis or a big crisis, and you know, you sort of help them manage that, navigate that, and now they like actually really thriving, doing well for themselves, like, you know. And it's like, I'm not even going to sit here and be like, yeah, it's all me. I take, no, it's more like it's actually all you. I'm literally here just kind of like, you know, giving a little gentle push, providing some guidance, maybe, you know, some medication if that's helpful, and, you know, if it's indicated, and that's it. You know, it's like, you know, and I also really like the fact too, like I gotta mention this, like the representation piece, because I don't think it's like 100% the case where like any black person, or especially like a black male, should have a provider that looks like them. But what I think is that should be an option for everyone. Like we have to get to a point where that's a potential option, because for some of the people who are in that demographic, when they come for treatment, and they meet you, that it's like, it's like a celebrity moment. Like, wow, like, I can't believe it. And it's not just that. It's like it can start like that or get like that at some point, but it's more like, sometimes I would see people who would be like, they would be described as defiant, non-compliant, whatever, some pejorative terms, and like they don't really like to open up. It's because they've been through some things, they've been traumatized, and then they will see somebody like me, and next thing you know, they want to talk to me all the time, like, we really got something going where we can communicate effectively, and they get to express themselves in a way that hadn't been done before. And it's just like, that's just like a beautiful thing, and that's something that everybody should have, but it's like, for some people, it just takes the right person, and oftentimes, like, it's hard to find that. So
yeah, no, I definitely think that's definitely some interesting points there for sure. And I think, again, that probably points back to even like the importance of like that connection.
Exactly.
And I imagine like that's even more important in a field like psychiatry, where there's constantly communication between the provider and patient.
And I'm thinking of too, like, a lot of the people, when they have interactions with systems or with some kind of authority, a lot of times the interactions are negative or not very warm or not very welcoming. And so by the time they reach you, it's like they're kind of like walled off, kind of like shut down because of all of that. But it's like, I think when you interact with anybody, you have the opportunity to help to sort of get them to a better place with all of that, and be able to navigate the world differently in a way that works for them, and they don't feel as like targeted. And but it's like, it's something that, well, all the systems got to change first, but we can't change all the systems like this. So we do what we can in the rules that we have.
So I think, even going a little bit more on that point, I do want to ask you, what would you say was probably, because I know you've given some examples of how like patient interactions can go and stuff like that. What do you feel like is probably the most memorable, or one of the most memorable patient experiences you can think of? And also with the caveat of, not violating HIPAA, I was want to make sure.
Yeah, of course.
But yeah.
Ooh, I mean, I would say, I feel like there was so many. I think I really got to think about that. Yeah, because it's like some of the examples I given, like, okay, I'm just remembering back, like, because before I started working in the outpatient world, I was working in juvenile detention. And if you get to the point in your life when you're in juvenile detention, it's like more than likely you had significant problems, significant trauma with different systems, school, law enforcement, police, probably child protective services, all of the above. And so, I remember like meeting people, and they were really like, I don't I gotta laugh a little bit too, because they were like, nah, you know what, I don't need mental health. No, I'm good, I don't need that. And I'm laughing because I'm like, everybody needs mental health, but that's what the kids would say, like, no, I don't need mental health. So it would be like, the thing, the way we'd kind of, I guess, try to work around it, or try to support it, would just be the most basic, being present. And by being present, I mean like the different halls that the kids were on, sometimes would just go there just to spend some time on the hall. Like, they would be playing cards, so sometimes play cards with them. And then next thing you know, after a while of doing that, like a couple times, somebody who I did not expect at all, they would be like asking to talk to me. And I'm like, this person wants to talk to me? Really? Okay, let's talk. And then a lot of times, even with that, it would be not much communication. It would be just kind of like, you could get the feeling that they got things that they want to say, things on their mind, but they're like, just like stuck in a way. And after some time, you be hearing about, they would be dropping little jewels and gems, and the next thing you know, they're like telling you about things that have happened, telling you about things that they've been through and things like that. And it would be a lot of experiences like that. Like, when I say a lot, I mean way more than I would have ever expected. It's like I come in, I just like want to do the best that I can and try to, like be a doctor. It turns out that being a person is more important. They surprised me with the things that they wanted to talk about eventually, and it was like, these are the same people who were doing that are the same kinds of kids who, when I was in training, in residency, there would be certain people, they'd be like, oh, this person's not a good therapy candidate. And it was like, actually, I think all these kids want to do therapy, they just don't know it or just haven't found the right platform or opportunity. I think they all not necessarily want to, more like be willing to, and if they could really see like the benefits and whatnot, they'd be more interested.
I think that's I think it's probably something there, because one thing I think about just off of that is probably a lot of the misunderstandings that maybe come up that I'm sure you have to deal with at times.
Exactly. You know what? It's funny you say that. That just put in my brain. So before I decided to pursue a career in psychiatry, it just reminded me of like the stereotypes of what you thought a psychiatrist might be. Some older person, bald with a white beard, like, barely making eye contact. That's what just came into my head when you said that. And it's like, I guess it was in the back of my mind or something. But I was like, you know what? We're still gonna do this because it feels like the right thing to do right now, and seems to be working out so far.
Yeah, it's definitely good then. Yeah. So going a little bit forward. So I know we spoke a lot about, your career so far and some of the things you've learned and picked up and different things about, your career as a psychiatrist and a child psychiatrist particularly. So there's like a set of questions that I do have that I think are more so probably directed to some of my own things I've wondered about the field of psychiatry, and haven't actually had like a psychiatrist to answer them.
Let's do it.
So if you're comfortable,
of
I
course.
do have. Yeah. So the first thing is, and I also hear about this a little bit when it comes to even like other fields, like probably a little bit more towards something like primary care or cardiovascular health and different stuff like that. But I do also hear this, or I do also think a little bit about this when it comes to the field of psychiatry. So I think one thing that I notice at times, there's probably a good amount of people that often have like a lot of like questions or / concerns about I guess what exactly the role is when it comes particularly to the aspect of psychiatry, like any other specialty. Do physicians ever tend to overprescribe particular things? I often hear that sort of thing when it comes to like antidepressants or like specific medications like that. And I think one of the things I'd probably want to know, at least obviously you'd probably be speaking more to at least your own experience and what you know about it. Yeah, like how do you navigate prescribing particular treatment for patients, like when you feel like they're at a point at which they may need something like that, and how do you make sure you're able to do that, sort of I guess like a necessary time, and sort of how do you navigate some of those things?
Oh, that's a great question. I mean, one of the things that actually I would say, to the field's credit, has come up while I was in training was the concept of deprescribing. And deprescribing came up because, like, in certain settings, a lot of patients would be prescribed either lots of different medications, high doses, or both. And I would say for myself, I start with like what's really going on with the person who's with me and trying to understand like where they're coming from, where they're at, and really getting a sense of like what the underlying issues are. And I would say like that kind of mindset has really been what guides me. And then as far as like when it comes to managing the decisions on what to do and what not to do with the medication piece, I really think about like look at and evaluate the level of functioning, like how this person is functioning now. If the person is like really struggling, that would be a situation where I would be leaning more towards medication, and it would be focused on like whatever my understanding of the underlying issue is. But actually not just my understanding, like our shared understanding,
Mm-hmm.
because I would be sharing that with them, what I think is going on, trying to explain it, break it down, and also encouraging people to do research on their own as well. And then seeing if like, are we seeing eye to eye on this? Okay, this is something we can do about that. And it's like I don't I don't usually go aggressive with it. I try to avoid being aggressive and just kind of like take it one step at a time. And if if they're having a lot of issues, a lot of struggles, then I would say a little bit more aggressive. But if that's not the case, then it's like we can really just um, see how it goes. And in general, I kind of err towards less than more, and and also like think about it in terms of, because one of the ways I describe like mental health overall is I use analogies that I've heard before, like either everyone has their own toolbox or everyone has a version of Batman's utility belt. And it basically boils down to like, for ideal mental health and wellness, we got to make sure there's certain basic things in place, and that the basic things would be things like getting enough sleep, having a nice balanced diet, getting some exercise in, fresh air, sunlight, things like that. Ideally, some positive, meaningful relationships, which folks can't take for granted because that's not always guaranteed. And then beyond that, would be things like practicing mindfulness, yoga, whatever other things folks use to sort of help manage themselves, like music, dancing. You always encourage movement. And then beyond that would be things like therapy, individual, group, family, and medication is also there. And then there's also like the different levels of care you can have with that. But everyone should ideally, like let's figure out together what what tools work for you, and help you to maintain and manage yourself.
Yeah, no, I think that's a good point, and I think you even bring up like two, I think, really key aspects of that. I think number one thing I probably didn't think about as much in terms of just like actually working with the patient, on like what exactly the plan is and things like that. And so I think I'm sure having the patient being as informed as possible and being a part of that process and understanding what's going on and weighing out the options of what might be helpful for them, I'm sure probably also helps kind of keep things in check and stuff like that. And I think the other aspect you mentioned of, which I think is definitely crucial as well, is kind of like that holistic aspect of not just, one angle, but also looking at here all the different things. Like you mentioned, the utility belt of things that could potentially be able to like help that patient. And so I think one thing I think about for sure, and this is also kind of part of another question I wanted to ask you, was really just as you mentioned some of those things, like how do you sort of implement holistic methods into your practice in terms of helping patients, especially even in the scenario of somebody you do kind of end up leaning towards giving medication or trying medication as a part of that process. How do you kind of utilize maybe some of those holistic aspects so that it's not just just aggressive sort of medication thing, but really looking at it in a way where you're kind of seeing like what's going to help the patient and it doesn't end up overwhelming on a particular
That's
side?
a great question. I would say, well, in the settings that I work, I do often, it's like a collaboration with individual therapists as well, or family therapists. And a lot of times they're able to incorporate that. When that's not possible, it's like, let's we at least talk about the different things that could be done, and like let's encourage that, let's practice it together or something like that. And if they're open to that, or perhaps there's someone in their life they might be able to practice with or engage in that with. So definitely, and if I had my way, I would make it like more widely available for others, because I actually would really like lots of different types of options available for the community if possible, just because it's like, yo, we got these different things that could be done, like, let's see how it works for you, stuff like that. Mm-hmm.
Yeah, no, I think that's key. I think probably having that host of options be available to somebody
Exactly.
is probably key to, I guess, maybe probably avoiding some of those concerns or challenges of, not ending up, I guess, like over prescribing or,
Mm-hmm. Exactly.
ending up leaning towards one particular thing, but kind of having that wide array that is probably going to also help for like tailoring to particular needs
Oh
of different
yeah,
patients.
and even just knowing about things that are available, I think that's helpful for folks, because it's like a lot of times people don't they don't know what's going on. It's like it ends up, unfortunately, you know the I guess the most useful information is not widely available and accessible as it could and should be. And so, we end up in a world where it's like you come across folks who are learning about different things for the first time. And it's like, it'd be nice if they knew about it beforehand, so as it could have been helpful for them. But, this, we can just do what we can from our positions.
Definitely thank you for that, because I think that kind of helped clear up some things that I wanted to ask.
Mm-hmm.
So I do want to take a bit of a pivot. There's another
Let's
thing I
do
want to
it.
ask you about. So, of course, really anyone who's going to be listening to this podcast is going to be able to immediately think to the fact that we all know we dealt with like a global pandemic,
Oh,
COVID-19,
yeah.
and things
Mm-hmm.
that I'm sure plenty of people are still reeling from the effects of. And one of
Mm-hmm.
the things I do want to probably ask you about is what are some of the long-term impacts of the pandemic that you might have possibly seen in like your
Oh, yeah.
practice, and how
That's
do
a
you
good
feel like that's
question.
affected young people?
And honestly, I would say we're kind of still seeing some of those, still like investigating, still gonna
Hmm.
find out more about like longer term impacts. But as of right now, I feel like for a lot of the people, it kind of like was very uh, disruptive to their livelihood. Like a lot of people and children in particular were, I want to say like able to move on, but it's kind of like that. I don't think it's like everyone just kind of fully moved on, because it's like the effects of that where everyone's still dealing with. But it's like some of the kids were able to by sort of move on. I mean, like continue regular school after they had this time period where being in person was disrupted. But a lot of the referrals that I've seen and that we received were related to some form of like inconsistent or basically non-existent school attendance. And a lot of it, it happened to so many people. And it's like some of them even got to the point where it's like they really don't leave their house much or leave the house at all. And it's like, this is not something that was very common before pandemic. Like it definitely happened, but now it's like way more common. Like so many of the referrals have been related to something along those lines. And so, like that's like one thing. And then other things related to that is like, I would say sometimes like some kind of like arrested development in a way. Like people, haven't been able to, properly mature properly, because it's like that major trauma happened and folks are stuck. And then it was also not just a major trauma of the pandemic with everyone having to be in at home shutdowns. It was also a lot of people experience deaths in close family members, close relatives, and so that those different effects can be cumulative, and it's like it can really sort of like disrupt the natural flow. And then with other world events happening, it's like there's a lot of uncertainty, a lot of like general tension and anxiety. So I say, even stuff like that kind of has people feeling on edge or hopeless. So, you can see reactions in different ways to that too. Like, sometimes, increases in like different types of crime, increases in like shootings, increases in like other things. And it's like, I feel like in some ways related to back to that, like a sort of general kind of hopelessness and people just kind of like not really having faith in humanity or that, things will get better. Because it's like for a while it was like it's not really seeming that's possible. So it's tough out here.
So how do you think, as a psychiatrist, you've been able to, I guess, try to help people navigate some of those things if you've had those opportunities?
Oh, definitely. I would say from my position, it's kind of like just like trying to have people recognize like the general limitations that we have as individuals. Like, there's so many things we as humans we sort of like try to give ourselves a sense of comfort from being in some kind of control, but just recognizing having people recognize the reality, like there really is so little that we can control. But there are some things that we can do to try to sort of put ourselves in the best position that we can to succeed, and just kind of encouraging and supporting people to figure out what that is for themselves. It's probably the best way to put it.
I'm sure, like, I would imagine that's probably helped a lot of people in terms of, I guess, like the framework through which like they're thinking about some of those problems or some of those things going on.
I hope so. No, I think so though, for real. I think so. And then it's like I'm so glad like there's more open conversations about mental health and things like that, and with some people acknowledging like they went through things and then they were able to go get it taken care of. And then so I think that also helps encourage other people, provide some kind of hope and inspiration. So
yeah, so definitely appreciate that there, getting to hear sort of that perspective. So there are a couple more things I want to ask.
Okay, cool. Let's go.
So I imagine this would be pretty useful for a lot of the people that are listening here, especially if there's like a younger audience. I do want to ask you, from all the experience that you've been able to gain through all the years you've been doing psychiatry, and also particularly child and adolescent psychiatry, what would you say, or maybe if you just had like one thing, what would you say is probably one recommendation that you would have to young people in general on how they can sort of take steps to improve their mental health?
Good question. What should young people do? It's funny. The first thing that comes to my mind is like what I sometimes tell families. It's not even for the young people to do, but what I sometimes would tell people in general is like the best thing that could happen for any individual is if they had like a loving, supportive network, and in particular if it was like their family. And I'm like, if I could write a prescription for that, everybody would get that. Like, but it's like we can't, right? So the fact that we can't do that, it's like boo. But young people, I would say, hopefully with with all of the different conversations going on, hope they at least can take an interest in their own mental health and their own wellness. And besides doing the usual things that folks do, I would hope that at least part of it is some kind of outlet to be able to express themselves, because I think that's something that is, in general could be done better. And by express themselves, I mean like that could look like therapy, like being engaged in individual therapy. But it could also take other forms as well, like journaling, like making music, or like writing your own lyrics, or even drawing, painting, and like expressing yourself. Now, like different things aren't necessarily like a substitute for therapy, but I think all of those things can be therapeutic in its own way. And so as long as people are able to express themselves, and like I think that can be helpful and therapeutic. And if at any point, like please don't be afraid to seek help, seek additional support. Like it doesn't have to be like I'm in some crisis kind of situation. It really could just be like, you know what, I just feel like talking to somebody. I just feel like like I just want to get checked out to make sure I'm okay. And well, I can say you're okay, but you're always okay. You just might be going through some things. So, and if you're going through things, like having someone to talk to can be helpful. Having those people in your corner can be helpful.
Yeah, that's definitely good. I think those are probably some points that are really important, and I probably also been able to see if helped me out a little bit here and there as well. I can even just think, just as a small example, like school.
Exactly.
I think I've been able to have some of those things, whether it's been like hanging out in the student lounge with people playing ping pong, or having conversations with like underclassmen or upperclassmen, getting advice, and some of those things I think have definitely helped keep me at least like engaged when it comes to some of the things, and dealing with some of the stresses of school and all of that.
Exactly. And as you're talking right now, as much as I would say overall love my experiences and everything, I would say like it was definitely like really hard, like it was really challenging. And I mean, not just like it was like that in different ways, just like from starting out of high school to like the type of courses that you took, and like the pace, and like we're the age that we were, and like other people who are not pre-med majors or not medical school folks seeking to go to medical school, they're like out having a good time, and you're like, sometimes like, hey, I want to do that too, which we did sometimes, of course, but it's like they're doing it more. You're like kind of struggling like with your identity. You could be struggling with your identity, like maybe I should be doing that. I don't know, but yeah, I just wanted to acknowledge that. And even, and I'm even acknowledging that right now to just make a point, like even something like that where it's really challenging, really hard, and you just happen to be doing well in it, consistent, it is still a stressor. It is still something that is worth exploring with someone else, talking about your experiences. And if even if you're really doing well at it, because it's like something, just kind of having that outlet could help you to do better. So
there are a couple more, or actually pretty much I have maybe like one or two more things I want to ask.
That's cool. Let's do it.
I always love being able to like ask people this when I'm kind of doing the interviews. You remember mentioning like with the bio, like all the different stuff I'm able to be involved in, and committees that like you join and things like that, and being very involved in like New York City, and some just all those different things surrounding mental health and all of that. What would you say probably like motivates you to do like a lot of the work that you've been doing?
I think those things kind of just find me somehow, some way. But no, stop. Sometimes they do, but no. Actually, I would say, it's kind of like I recognize like there's power in the title. There's power in the education, and it's like I have the opportunity to basically be able to have an impact or more of an influence on more than just working on an individual level, which is great. And so I'm like, let me look into this opportunity and see what I can do. because if I could potentially help out some more people, that would make me feel even better. Like, I'm glad that I was able to use my power, whatever power I had in that way. And those are like the kind of things that I would want to be my legacy, like I would want people to know me for that, like that's what he did, and not just like kind of let opportunities just go by. And
yeah, that's good. Yeah. Definitely hearing, in terms of like be able to kind of seize a moment and use some of those things to your advantage to ultimately be able to kind of make some of that impact. So I think the last thing I really want to ask, so one of the things I always try to do on the podcast, whether it's my own episodes or in interviews and stuff like that, is I always want to be able to speak to people who are along the medical path like myself, whether that's all the way at like high school or pre-med or something like that, all the way to people in like residency perhaps, and kind of be able to inspire sort of like that next generation of aspiring physicians. And so one thing I would definitely want to ask you, from the point that you're at now, from having gone through that entire path and be able to impact people as a physician, what's one piece of advice that you would want to give to aspiring physicians, if you could think of anything?
What I like to tell the younger people who want to come up is like, when I was going through the pathway, there was a lot of self-doubt. There was a lot of like, I think probably the whole time up until actually quote unquote making it was a feeling like, I don't think this is going to happen, or I'm not sure if this is going to happen. And then along with that too, it was whenever interacting with like senior people, like anybody who was more senior, like whether it was like doctors in practice or, somebody at the next level up, I kind of always had this impression, which is not accurate, but it was my impression. It was my feeling like that this person who, accomplished whatever they accomplished, like they're elite smart. They, probably had like straight A's or whatever. They probably never struggled in their life. And, but that's not true, but that's how I felt. And I feel like that was the impression a lot of people gave. So when I'm talking to somebody who's young, I'm like, listen, it's really challenging, and there's gonna be times when things don't always work out in your way. Like there were definitely times at each point in my career where it was like something exam failed. I had to redo some paper. I had to, retake an exam, and it was like those situations when they came up, that was like the worst, because it would be like literally, well, I don't know if it was literally, but it felt literally like, oh, my career is on the line right now. Like, but reality is like most people who end up making it at some point do actually have some kind of struggle at some, and it's like, yo, you know what? Honestly, that's okay. Like that's part of life. It's just more of like, once something like that, before something like that happens, doing whatever you can to try to prevent it, like by taking the whatever tutoring is available, whatever coaching, whatever advice you can get from other people. So you do all of that, and then unfortunately, sometimes it does come up, and then after that, it's like same kind of concept. Like whatever I was doing I wasn't getting it. It wasn't right. So trying to kind of roll with the punches, roll with the whatever happened, and like, come on, relying on the community help. Let's figure this out together. And I think if people are like that, it's something that you can really go far with. And then besides that, the other thing that I think was also really helpful was I throughout the whole process, I would do things like proactively do things that helped me to stay inspired. So like when I was in Sophie, for me, it was things like reading memoirs of other physicians who made it, and they were talking about their experiences.
Inspiration.
And I'm just like in any moment when I'm like feeling like like uninspired, I start looking at that. I'm like, all right, we could do this, and even now, like, I still do stuff like that. Like that wasn't like the only thing that motivated me, because there was other stuff like, you got your hype music, you got your hype song. I would listen to my hype songs before an exam. Like, yeah, we got this before a big exam. I would also pray. Like, I'd be praying. Let's keep it real. I pray, like, before the exams and everything. I feel like that was helpful too, So, but yeah, doing things to stay inspired really went a long way.
Yeah, no, that I think it's definitely a huge takeaway right there. So for sure, appreciate that.
Yeah, and now, like, there's more books from Black physicians out. Like, I feel like every other day, every other month, somebody's dropping a new book. Where, like, when I first started looking, like, there was some, but it wasn't that many. And now it's like, okay, it's like a gold mine. Like, you can read this one, you can read that one, and even like, I think only one of the ones I read was like from a Black psychiatrist. But, so most of the people I'm reading behind were in different specialties. But, like, it's cool with me. Like, it's inspirational regardless. So
yeah, so I think that pretty much wraps up everything I wanted to ask you.
Right.
I definitely thought that was super duper helpful, so I definitely appreciate it.
It's a pleasure, man. I'm so glad you did this podcast, because one thing we didn't talk about was that we don't need to go deep into it, but I just want to acknowledge that this podcast here was really helpful for one of the projects that I took on. This podcast was really helpful in sort of providing some up-to-date relevant information that I included. So thank you for that.
I'm glad to hear that it could potentially be making some good contribution.
Clutch, like Michael Jordan. For real though, for real.
Yeah, so I think that pretty much wraps up the next episode of the podcast.
Thanks for having me.
Yeah. So if you're still listening, I'm super happy that you're here. Definitely, again, make sure to give it a like, share it with someone. I'm definitely sure that a lot of you guys listening got a lot out of this interview. And so really, with all that being said, that wraps up this episode, and I'll see you in the next one.